So the second receptor is the cardio. This is the cardio receptor. Okay, cardiopulmonary receptor. Okay, cardiopulmonary receptor. So cardiopulmonary receptor, you can tell CPR. Okay, first of all, this is present in the, actually in, this is the pulmonary artery. Okay, it's actually regulate blood volume. Okay, not a blood pressure. It actually regulate the blood volume. On the basis of the blood volume, it give response to the body. Okay, it present in the pulmonary arteries. Okay, pulmonary artery, that's why it is called pulmonary cardiopulmonary receptor. So it is present in the pulmonary arteries and pulmonary arteries. Okay, so it give information through to the in the present in the pulmonary artery and to the vagus nerve. Through the vagus nerve, it goes information. For example, if blood volume increase, it give information to the vagus nerve, and from the vagus nerve, the information goes to the brainstem, and the brainstem, it goes toward the cardiovascular center. And cardiovascular center, for example, if the blood volume is increases, okay, that more blood come to the heart. Okay, so what it do, it actually increase the heart rate. If the heart rate increase, it actually increase the heart rate, and also increase the there are two accelerator. One is a cardiac accelerator, another is cardiac deaccelerator. So cardiac accelerator increase the heart rate and increase contractility. The next other thing is the hypothalamus. For first, it goes toward the brainstem. Another thing is it goes toward the vagus nerve, goes toward hypothalamus and hypothalamus. Okay, after, next thing you have to remember that there are in the ventricle and the artery, there are the ANP, atrial natriuretic peptide. Okay, and BNP. BNP is present in the right ventricle and ANP is present in the atrium. Okay, you have to remember this. Now the thing is that relative low pressure volume, it is also called relatively low pressure and volume baroreceptor, because the pressure is less here. Actually it is the volume reflex and control the volume. So if blood volume is increased, it actually stress. If blood volume is increased, vagus nerve fire signal. Okay, when vagus nerve fire signal, okay, there goes toward the cardiovascular center, and it increases the heart rate. And when heart rate is increases, so you have to remember that cardiac output is equal to heart rate multiplied by stroke volume. So if the heart rate is increases, so the cardiac output automatically increase. When the cardiac output increase, so more blood go toward the kidney. When more blood go toward the kidney, increase water and sodium excretion. So more water is excreted, more water and sodium is excreted. So as a result, the blood volume decreased. More water is removed from the body through the kidney and urine. So the blood automatically, all the blood volume is become decreases. So blood volume actually come back toward the normal. This is called brain bridge reflex mechanism. Okay, what is brain bridge reflex mechanism? Brain bridge mechanism is actually when the more blood come to the atrium and ventricle. Here ANP and BNP are the atrial natriuretic peptide and brain natriuretic peptide. These are released. Okay, one is this, and another vagus nerve. To the vagus nerve, these are the information goes to the vagus nerve and the cardiac accelerator, deaccelerator, hypothalamus. So cardiac vascular center actually increase the heart rate and cardiac output. Okay, when the cardiac output increases, blood to the kidney is also increased. Blood to the kidney increases, more water and sodium is excreted. So you have to remember that ANP and BNP increase the water and sodium excretion. Okay, as a result, the blood volume is decreases, so blood come to the back. This is called brain bridge reflex mechanism. Okay, now another thing is cardiopulmonary. If blood volume increase, then cardiopulmonary receptor also stimulate atrial natriuretic peptide. Okay, if blood volume increases, I have already tell, one is the through vagus nerve and another is the it also stimulate the atrial natriuretic ANP and BNP. And ANP, what the function of ANP? ANP actually renal arteriole dilation. It do renal arteriole. For example, this is renal arteriole. It actually increase their diameter. It actually increase their diameter. When their diameter increases, so more blood come in. Okay, relatively more blood filter. So as a result, more blood become filter, inhibiting water and sodium reabsorption. There no water and sodium reabsorption occur. So the next thing is called, for example, blood volume is decreases. vagus nerve fire and it sign to the signal toward the cardiovascular center and hypothalamus. As a result, what hypothalamus do? Hypothalamus decrease the production of vasopressin. Okay, decrease the production of vasopressin, and vasopressin is actually antidiuretic hormone. Antidiuretic hormone. So the antidiuretic hormone, antidiuretics antidiuretics hormone become decreases. Okay, when this decrease, water reabsorption water reabsorption water reabsorption water reabsorption increases. Actually, water production of when the production of vasopressin decreases, okay, the add for example, you have to read vasopressin decreases, so atrial diuretic hormone is decreased. And what the function, atrial diuretic hormone function is to decrease water absorption in the kidney. But if the antidiuretic hormone is decreases, so more water is absorbed. Okay, it is like this. Okay, more water is absorbed if the progression of vasopressin is decreased in the kidney. It is actually the function of the this hormone, antidiuretic hormone, when it increased water reabsorption. So now the next thing is that you have to remember. Now, for if the blood volume is decreased, you have to understand now again. If the blood volume is decreased, cardiopulmonary receptor less stretch. Okay, when they less stretch, reverse all the effect. So first of all, the heart rate is decreases. Another is hypothalamus. Vasopressin is increases. The amount of vasopressin is actually increases. Okay, so if the amount of vasopressin is decreased, water reabsorption increases. Okay, another is less ANP is secreted. So if less ANP is decreased, renal arteriole actually constrict. If this is not in decrease, if this is not releases, okay, less and there are more NP, there is renal vasodilation. If this is less NP, there is renal arteriolar constrictor. Okay, so less blood goes to the renal. Okay, and less blood filter, less water move out. So the heart rate is decreased, cardiac output is decreased, renal blood flow is also decreased, and water excretion is also decreased. Now you have to remember that vasopressin is actually antidiuretic. And what is the function of antidiuretic? Antidiuretic increase the reabsorption, okay, and urine become less. If the antidiuretic is increases, urine become less. This is inversely relation. Antidiuretic is directly to the reabsorption and indirectly to urine production. Less water is excreted, blood volume increases, and volume of the blood comes toward normal. So this is the mechanism. Now again we will summarize this, that the baroreceptor actually atrial baroreceptor and cardiopulmonary receptor. So it responds to the blood pressure. Atrial baroreceptor responds to a blood pressure change, and glossopharyngeal through glossopharyngeal and vagus nerve. Okay, goes toward cardio accelerator and modified total peripheral resistance and cardiac output. Cardiopulmonary receptor is actually low pressure region at low pressure and volume regulator by influencing water excretion by kidney. Okay, so up to this you have to remember the everything. Now there is nothing left. Okay, we have extend the baroreceptors, cardiopulmonary receptor and atrial baroreceptor.